Hello, my name is Ahmed Khaleel, and I will be presenting a little bit about Parkinson's disease, its manifestation, and one medication to manage the condition, along with my case study, which involves Emma, a 70-year-old female who's been diagnosed with Parkinson's disease. Parkinson's disease is a neurodegenerative disorder, which means there is an irreversible loss of neurons, damage and destructions to parts of the nervous system. It's referred to as idiopathic because it's a cluster of symptoms and there is no known cause. The manifestations includes bradykinesia, which is slowing, and in order to be diagnosed, you need to be diagnosed with bradykinesia plus a resting tremor or rigidity for a period of time. Where bradykinesia is slowing of the movements. Other features include a loss of smell, sleep dysfunction, excess salivation, constipation, and limb movements in sleep, unsteady gait. Now, what happens here is there is a depletion of the dopaminergic neurons in the substantia nigra, which we will go to later, and there is no blood test to diagnose dementia. It's only when a brain's autopsy is done you will find tau, which are the Lewy body proteins. So what's happening here? Now this is a cross-section of the basal ganglia. I'd like to concentrate on the green arrow number 1. So the motor cortex at the surface passes a signal to the striatum when a movement needs to occur. Example, when I want to move my hand. A signal goes to the external, then to the internal pallidus, and then to the thalamus, which is the gatekeeper. It gives permission to move, and the signal goes to the cortex to move. Now, this is referred to as a direct pathway. Now I'd like you to concentrate on the red pathway, which with number 2. Another signal from the cortex goes to the striatum, then to the subthalamic nuclei via the pallidus. From there, the thalamus, and this time it doesn't give permission, which is an indirect pathway. Meanwhile, dopamine, which is a neurotransmitter, gets released and communicates with both the pathways. To the direct pathway, it says a yes. To the indirect pathway, it says a no, which is inhibiting an inhibitory pathway, which results in a yes. And this way, a movement occurs. In the absence of dopamine, there is a continuous start-stop mechanism taking place, which we see as involuntary shakes. This condition is managed by dopamine therapy, and levodopa helps dopamine go into the brain. So what increases the likelihood? 50 to 80% of dopamine-producing neurons are dead by the time the disease shows up in the form of symptoms. Family history can have a gene that can be carried on by the offspring. There can be a gene that can directly cause Parkinson's disease, or there can be a continuing contributing gene that can increase the likelihood of Parkinson's disease. Manufacturing industries' harmful cleaning chemicals have also been found as contributors. Age has also been one, and if we go back to Emma, our lady from the case, she is a 70-year-old woman. We know she has had recurrent falls, which only adds up to the progression of the disease. Men are at higher risk than females. Environmental and working conditions. They get more access to harsh working conditions in industries. And men can be more exposed to lead, manganese, and copper than women, which um, adds up to the progression of the disease. So how does it feel? It's like having a somersault in water, and we can relate that with Emma, and that's how she must be feeling, like a very uh, eff- full of effort movement. There is no treatment. We can only manage the symptoms with non-pharmacological and pharmacological approaches. The non-pharmacological approaches include physiotherapy, and we know Emma's having falls, so she can have some physiotherapy there. Occupational therapists, including she can have a four-wheel frame and cutlery and utensils, very designed specific for her. Speech therapist to help her with the slowing of the speech and swallowing. She can also look into nursing home or home care. The pharmacological intervention includes levodopa, which is a medication used. It's a dopamine precursor and a replacement agent, and it's effective in bradykinetic symptoms. It crosses the blood-brain barrier and converts dopamine into the central nervous system and the peripheries. It activates more synaptic dopaminergic receptors. Now, along with levodopa, carbidopa is also given, which is a peripheral decarboxylase inhibitor. So what this does is it stops the dopamine production in the peripheries and encourages the dopamine production in the central nervous system. The adverse effects are dizziness and somnolence. Somnolence is where someone just wants to keep sleeping, and Emma can have these adverse effects. It's contraindicated with monoamine oxidase inhibitor, which are medications used for depression. It can cause levodopa with these medications can cause hypertension, cause a sudden increase in blood pressure. Example is tranylcypromine. Now, as a result of the pathophysiology of Parkinson's disease with Emma, and she's got these symptoms of bradykinesia, rigidity, tremors, unsteady gait for the past 2 years, and trouble walking with history of falls, she most likely will have swallowing difficulties, chewing issues, and slow peristalsis, which can lead to constipation, and also have poor coordination, which can lead to increased falls. So, levodopa and carbidopa both can help Emma manage her symptoms, and she can manage her shakes. She can have more stability and coordination, which can help her with increased physiotherapy sessions and have less falls and manage her diet efficiently. So that was some information on Parkinson's disease. Thank you for listening to me.